A commonly asked question is genetic problem a reason for my IVF failure? Believe me, the question can be yes, answered yes or no. If your age is high, like let's say beyond 35, you have obesity, you have low ovarian reserve, and you could have some more genetic issues, there is a high risk that you could be having an embryo or you develop an embryo out of IVF with chromosomal abnormality. When your age crosses 35 years, or especially when it is crosses 38 years, chances of having chromosomally abnormal embryos increase. So the commonest failure reason after 38 years of IVF is chromosomally abnormal embryo. So the studies which are done by Poseidon group say that at the age of 38, you require 9 blastocysts to have one euploid embryo. So have you been promised a rocket success with one IVF cycle? Don't fall prey to these things. Probably you require to adjust your mind and go for multiple IVF to achieve that unique pregnancy. Then why not go for a PGTA testing of euploid embryos right in the beginning? The evidence is not greatly in favor of that, but just realize from the value added information. So we practice a consensus medicine and evidence-based medicine, but what I love to practice is a value-based medicine. Suppose you go through an IVF cycle and you transfer an euploid embryo, your chance of pregnancy is definitely high. I'm not talking of the policy decision, I'm talking of your chance of pregnancy. Simply because all the people you're seeing around in your family, in your community, are all living people living on this planet. And why are they living happily on this planet? Because they are genetically normal, because they are euploid. Any one of us is genetically abnormal, all the genetically abnormal embryos get aborted. So we are essentially genetically normal, and that's why we are living on this planet. So transferring an euploid embryo is a definite value-based decision, definitely will improve the chances of pregnancy. Though the scientific evidence in a large number of patients may not be saying the truthful story. So this is widely practiced, especially in USA. Like a lot of my patients in USA tell me, whenever we visit a doctor there, they say, if you're ready to do a PGTA testing and transfer an euploid embryo, well, we can go ahead. If you don't want to test it, we still can go ahead. But don't ask me a reason why you failed. And does it cost a lot? No. At our hospital, it will cost you simply 8,000 rupees per blastocyst for testing. We do not take any premium charges beyond that because we know pregnancy is very important for you and every added cost can retard you from going from that success. So it's simply, don't have to pay any additional money to us, only money to the genetic testing laboratory has to be paid, which is simply 8,000 rupees per embryo. I'm sure this will benefit you and you would have raised a lot of queries. Do come back to us for any further clarifications. Thank you.